In this video, we're going to talk about service process design in the context of complex service processes, ones that may involve many process entities working together in a network of interacting entities. As we've seen, cooking the pizza is only part of what the pizza place has to do. You have to get the customer to tell you what kind of pizza is desired. You have to have the recipe. You have to have the ingredients ready. You have to get the oven hot, all sorts of things. The boxes represent process steps, and the arrows, the lines between the boxes, represent dependencies. In this kind of process diagram, the pizza places are a focal process entity. There is what the pizza place does when interacting with others, the region of direct interaction. There is what the pizza place does with resources and information of others, the region of surrogate interaction. There's what the pizza place does on its own with its own resources and information, the region of independent processing. The process diagrams can be very complicated, like there really are a number of other entities in the picture, each of which is the center of its own process domain. Here, the customer and supplier. Each is their own process entity, with their own process steps in their own process domains. You see that at the edges of the diagram. There's more to it than just the pizza place. Service processes are co-productive processes. On the diagram, it's the part in the middle, between the independent processes. That's where the service is. The provider and customer interact directly, or they act on one another's behalf, with one another's resources or with one another's information. In general, processes do not merely have to chain along, one feeding directly into the other. Processes can be organized in much more complex, even arbitrary ways. There might be a complex network of interacting and interdependent entities. Consider even just a simple toy example from the world of medical or healthcare services. There's the clinic, there's the patient, there's the insurance agency, there's the pharmacy. In this medical diagnosis process, the patient feels weak and needs a prescription based on a blood test. In this process chain network, the four entities connect together in complicated ways. The patient feels weak and gets to the clinic, waits, talks to the doctor. And based on a blood test at the clinic, the doctor calls in a prescription to the pharmacy. The clinic connects to the patient and the pharmacy. The clinic and the pharmacy also connect to the insurance company, which gets claims from both. Each of the process entities has some independent processes, some surrogate interaction, and some direct interaction with other entities. These are not just provider-customer relationships, but a network of actors operating together for mutual benefit. In general, process chain networks, or PCN diagrams, can contain an arbitrary number of process entities and can connect in arbitrary ways. PCN diagrams are the general form of the process diagrams we've been talking about. This is a technique for analysis and design of complex processes and complex service systems that enables us to see how provider and customer and other processes go together and should go together. The processes can chain along one to the other or even create complex networks or webs of relationships, as in the healthcare example.